welcome to MIT. Welcome to this workshop. My name is Pallavi Pant, and I work at the Health Effects Institute together with Allison, who's here. And we're very excited you're all here to join us for this session and for hopefully the next day and a half where we will hear so much from so many people about satellites and air quality. You'll hear also more from Allison about the work we do at the Health Effects Institute and why we're interested in this topic. But we are hoping that this afternoon session will give us an opportunity to talk in some detail about the types of things health scientists, epidemiologists, public health specialists are thinking about when they're planning and doing health studies, and how we can find better opportunities to work together and produce science that can be useful both in the US and around the world. So really thank you for taking the time for being here, and thank you to Arlene and everyone here at MIT and Jenny for making sure we're all here and with snacks and ready to go. I would now like to welcome Tracey, who can also offer her remarks, and welcome you all.
Hi, everybody. So nice to see you all, and welcome to what will be a really great 3 days. And thank you to Pallavi and to Allison and to the Health Effects Institute for organizing this workshop. This is the first time we're having an early career workshop before one of our meetings of the NASA Health and Air Quality Applied Sciences team. So what I'm here to do is to tell you a little bit about the team, which we pronounce HAQAST. It's a funny acronym, which stands for the NASA Health and Air Quality Applied Sciences team. And this team is in its third generation. So we've been going for about a decade. And when it was first launched in 2011, NASA had at that time had science teams around instruments. So there'd be an instrument up in space, and they would fund scientists on Earth to work on the research. But around 2010, NASA decided to try something new, funding not just the instrument, but actually around the issue. And the first issue they decided to fund was air quality. So the first version of this team was called the Air Quality Applied Sciences team, which ran from 2011 to 2016. Then it was recompeted, as they all are, through the NASA Research Opportunities in Space and Earth Sciences program, a competitive program where you write a proposal and you submit it and it's reviewed just like a lot of research funding programs. And then it was, so in 2016, it was relaunched with the H in front of it for health and air quality. Then it was recompeted again in 2020. And actually it's being recompeted again this year. So it's been an exciting 3 generations of this team. And the work, the mission is really to connect NASA science with health and air quality communities. So that's one reason we're so thrilled to be here with the HEI as the preeminent organization moving health and air quality issues forward. I'm just going to skip through all the types of work we do. Just to frame out, the team is composed of 14 different members. Each member is the PI of a grant, and they're working with collaborators, students, and postdocs. So all total, over 60 investigators are funded through the HAQAST program. Each of these are working with collaborators, but what we're really excited to do over the course of the HAQAST team, and we've been doing now for almost a decade, is to be growing that community and bringing in new partners, new collaborators, and addressing new issues. Well, some of those partners who've been especially involved are what we call the ambassadors. We sometimes jokingly call them the super users. They're representing organizations and people who've been very involved or want to be more involved in our work. And the work of HAQAST is then what people proposed in their original proposals, their member projects, collaborative work that's emerged over the course of the team called Tiger Team projects, immediate urgent issues that come up over the course of 4 years called rapid response projects. And then I do a lot of work with my colleague Jenny Bratbert, who you'll be hearing from in a few minutes, trying to run the team, send out newsletters, and host meetings like this, which we have about every 6 months. Our last one was in Salt Lake City, Utah. Our next one will be in early 2025 in Washington, D.C. And the goal of these meetings is really to promote two-way dialogue with the communities that we're connecting with. So as many of you probably know, and hopefully you'll be here for the next 2 days, this meeting here is a pre-meeting for our 2-day HAQAST Massachusetts meeting, which will have a full day of sessions tomorrow and a half a day of sessions on Thursday. So I look forward to getting to know many of you over the next couple of days. And I'll hand it over to my colleague, Jenny Bradford, to take us to the next step.
Thank you.
So basically, I wanted to get some interactivity going with this. We have a pretty big crowd here. So I wanted to hear from folks about what is your current role, and online audience can participate too if they want. So I guess I'll just go down. How many people are undergraduates? Okay. Graduate students? Yeah, graduate students, awesome. We should get you over the front. How many postdocs? Okay, yeah, good contingent of postdocs. Do we have early career professors? Yeah, we've got a few. All right, awesome. Do we have early career health and air quality professionals in the space? Okay, awesome, great. A mid to late career. Where are we? That's what you gotta be. Other roles, does anyone want to shout out if they don't feel like they fit in those categories? Okay. So next question would be, it looks like our online audience is mostly graduate students and postdocs, a couple early career professionals. So next question is, what is your background? So these are the, let's see. How many of you, I have 4 categories that I thought of that might be in this audience. Air quality, remote sensing, public health, environmental justice. So let's see who feels air quality. Yeah, most of you, that makes sense. Who just is like satellite data expert, that's how you identify. All right, awesome. Yeah. Public health. Okay, awesome. Okay, so we got a good mix here. Environmental justice. Folks working on justice? Okay, yeah, okay, raise your hands. Okay. Other backgrounds that people want to shout out? These are the only fields. Good. Engagement. Okay, and then what are you guys most interested in learning about today? And I'll just say for the online audience is very air quality focused. So what are you most interested in learning about today? So this will be helpful for our panelists if they want to adjust. There's a lot of things that we will be talking about today. How to build partnerships, what kind of funding opportunities are available, what are key challenges in using satellite data for health studies, maybe job opportunities, maybe something else that you asked. So I just want to see another show of hands just to see who's interested in how to build partnerships. Yeah, it can be very challenging to build partnerships. Who's interested in learning more about funding opportunities? Funding, okay. I'll talk a lot more about HAS funding too. Who is interested in learning about challenges for using satellite data for health studies? How to break into that? Okay, all right. I see a lot of the graduate students in the back. It's a challenge. Who's interested in maybe learning about job opportunities? Are there opportunities? Okay, cool. All right, well, I hope we can cover all those. And then also, I wanted to hear if there's anything that you want to shout out that you're thinking you'd like to hear about today. Someone has to say one thing.
I'm going to help you. I want to help bridge the gap between the geosciences and the health sciences.
Yeah, right on. Don't you all want that? Don't you wish you would all have that? Okay. Any other thoughts going through your head as you're like, how do I even reach the health audience or make data usable? Well, if you do have questions, we're going to have a really great panel later. And for now, thank you for participating in that. Oh, Elena.
Came off over with that. Publishing.
Publishing. Oh, yeah.
That's an important topic here.
Yeah. Any other thoughts come to mind? All right, I'll ease off. Okay, so with that, I will hand it over to Allison to tell us more about HEI and some funding opportunities.
So thank you, Jenny. And if any of you, I know a lot of people feel more comfortable asking questions or bringing things up in smaller groups or individually, feel free to just approach any of us at any of the breaks. We have breaks in networking time just for that, so we can all get to know each other personally. And so some of you, just one more question. Is anyone not familiar with HEI? Or yeah, let's ask it that way. People who don't know HEI and are okay. So there are a bunch of people who don't know who we are, but are still here with us for learning. That's really great. So I'm Allison Patton. I work at the Health Effects Institute, and I'm going to very briefly touch on who HEI is, who we're at as an organization, some of our funding opportunities, and what we look for when we have funding opportunities, to give you some high-level guidance on how to apply. There you go. Okay. Right. So HEI is an independent nonprofit organization that provides impartial science to inform decisions that foster a healthier environment and better health for all. We have three main programs. I work in the environment and health program, where our focus is mainly on ambient air pollution and transportation air pollution and how you measure exposures to those, which is where satellites fit in, and the health effects of air pollution. Pallavi, who you heard from earlier, it leads the global health initiatives, where they do a lot of work on science for informing global policy and convening. And also, if you've seen the State of Global Air online, there's a lot of great information on health effects of air pollution around the world. And the third program is Energy and Health, and that's on the exposures and health effects related to energy development. Right now, it's mainly oil and gas development, but it's also expanding. So this is an overview of our model. We could probably talk all day about any of these colored boxes. The main points are, first, we have a government industry partnership, so we have balanced funding from both sides to make sure that we're not biased towards one side or the other, and also to help us identify research questions that really matter for policy. A lot of our work has to do with funding of environmental exposure and health research. We have two independent committees. The research committee identifies research priorities, selects research for funding, and oversees research. So if you apply for funding, you'd be working with the research committee at first. And then we have a second committee, the review committee, that conducts peer review and handles summarization and communication of findings. Whenever we have research that's being selected, or all the way until the results are communicated, the sponsors do not have any involvement in the research. We're independent from them in that way. And all of the research is made widely available. So you can see all of our publications for free online. We encourage investigators who fund to make their data and code available. And we also have a number of webinar series and similar. So there are many ways to connect with us. our board oversees everything at a high level. We also have engagement and convening roles where we bring together audiences from many different sectors and many different organizations. This is part of our engagement role, working to connect, as Greg said, geosciences and health researchers. But we also do things like have workshops to plan research and many other activities like that. Okay, so funding opportunities. I know a lot of you are interested in this. These HEI is committed to supporting new investigators. So we have three new researcher opportunities. The first is a summer fellowship for undergraduate students from backgrounds underrepresented in the environmental health sciences. The fellows conduct research with a faculty member over the summer. And I didn't see anyone who's an undergrad here, but maybe you could consider mentoring or sharing the opportunity with others. The Jane Warren Award is a career development award to fund research. And it's, the Jane Warren Award is for travel funding to HEI's annual conference, and it's for graduate students and postdocs. Our next conference is in May in Austin, Texas. So hopefully some of the students here, postdocs, will apply and present. And the Rosenblith Award is a career development award for assistant professors. It funds 3 years of research. And we also have other opportunities. Typically, because we're very mission driven, the opportunities are based on very specific questions. Right now we have an RFA, or request for applications, as we call it an RFA, to strengthen community academic partnerships and conduct cumulative impact assessment. If you're interested in that, you have until June 18th to apply. We also, a few years ago, held a workshop on health applications for satellite-derived air quality. And many of the HAQAST investigators, some of them are in the room today and helping on the panel as well, were very helpful putting that together. And you can still see the recordings and the slides and summary online at the workshop page. We also put out each year a couple RFAs related to HEI's strategic plan. We're currently in the strategic planning process, so there's a draft plan for the upcoming 5 years online. But you can also watch social media. HEI posts on X and on LinkedIn, email newsletters, and our funding webpage for opportunities. So that's very high level. Really, it's about finding something that's a good fit and applying when there's the good fit for you. And when we put out an RFA, there's a lot of detailed information in it. This slide shows the key sections, and I'm not going to go into the sections because this is a high-level talk. If you have questions about specific sections, we can talk later. But basically, it tells you what we're looking for, how we hope the research questions can be answered. It'll tell you what's responsive and what's not responsive, how to make the data available. A lot of the research has either human subjects data or proprietary business data. And so there are ethics approvals that are often needed. And then, of course, there's information about the application process and deadlines. There aren't extensions, so keep track of deadlines and application instructions. There's also contact information. So if you have questions, you can just email the HEI staff person. And we usually have a webinar that explains how to apply to specific RFAs and has opportunities for questions about what would be responsive. So this is an overview of how we review applications. There's usually a preliminary application phase in which it's a short 4 to 5 page application, and the research committee reads those preliminary applications and considers whether they're likely to be responsive and able to answer the research questions. And then we send decision letters. The research committee tends to invite maybe 2 to 3 times more full applications than can actually be funded, but not more than that. And the full applications are usually by invitation only, but that depends on the specific RFA. So again, read the RFA. That's the most important thing. And because many of the RFAs are on very specific technical topics, we'll usually have a panel of experts on that topic who review the scientific merit of the proposals. And then the research committee makes recommendations for funding based on the recommendation of the panel and other factors, like not wanting to fund all in one area of the RFA when we want to cover several studies that cover all of the objectives. The studies recommended for funding by the research committee need approval by HEI's board of directors. Then we enter contract negotiations, and that's leading towards study startup, which would be a whole different topic. So just so you know, we have fairly standard evaluation criteria. The first one to get past the screening is relevance to the aims of the RFA. Like, we put out this RFA because we want to answer a specific question. So would the proposal answer that question? Second is the scientific merit and rigor. Is there a solid scientific plan? And if the plan as presented were followed, would it answer the questions? And then there are other factors that also are taken into account and very important are the people on the team, people who as all together cover all the areas of experience that are needed. Can you, have you demonstrated that you can do the work? Do you have sufficient facilities? So for example, if you're using tons of satellite data, you'd need very good computing resources and software. Do you have that? The budget and timeline are always important. Can you do it for the budget and time that you proposed? And also, are you over ambitious, under ambitious, or just right? And that's a very hard thing to hit, but it's very important. And what are the plans for disseminating results, and also for engaging communities? And so all of these are important, and the strongest applications will cover all of the evaluation criteria. And so, yes, as the others said, thank you so much for joining us today. I'm hoping that we can all connect and all learn from each other. And if you have questions later, I think Pallavi and I will both be at the whole meeting. And you can also email us at our email address is shown on the slide. And I think there's time for a few questions if anyone has questions about HEI or funding or how we review applications. I think we should have given everyone more sugar. Oh, Jenny.
Do you prefer that people reach out to you before they submit a pre-proposal?
So sometimes we'll ask for that if it's a very specific topic or we're on a tight timeline. Other times it doesn't really make a difference for us. But if you have questions, then certainly reach out.
Thank you. This is great. Can you talk more about the expectation of the research engaging community or partners in the process?
Right. So the community engagement requirements depend a lot on which RFA it is. So for example, the RFA that's currently open on building stronger connections between academia and communities, the community engagement needs to be very complete and well described and well planned. For some other studies, the community isn't as clear, like maybe it's a nationwide study, or the topic is of less interest to the people who might be most affected. So there's really a range of community engagement. Sometimes it's like just awareness and communicating the results to general audiences in a way that can be useful. And sometimes it goes all the way to community partnerships from the start of the study. So again, read the RFA and it'll explain each specific one.
So typically, what is the grant size for the Ross and Breathe award?
It's somewhere around $500,000. Yeah.
Okay.
I don't remember exactly.
That's right. But across across
3 years.
200,000 in total costs, so that includes directs and indirects, capped at 30% here.
Indirects capped at 30%.
And across 2 or 3 years.
Right. That's a good point about indirect too. So many institutions will have higher indirect. We're capped by government regulations, basically to 30%. But often people are able to work with their departments to negotiate that they can submit the application with the lower indirect.
I have a question. Over the years, HEI has funded a lot of epidemiological studies, and I know a lot of the audience here is coming from more of a geoscience atmospheric background. Do you see non-epidemiologists as competitive for HEI funding, or do they need to form a collaboration with an epi partner?
So my opinion, and others can weigh in too, is that it's important. The important thing is to show that the results will be relevant and useful for policy making and health research, whether or not there's a health component. So often that means that the most effective way to do that is to work with someone who already has the connections and the understanding of health research. But it's not a hard requirement in all cases. It's probably a good idea, I guess. So I don't see any. Are there any online questions? Okay. So we should move to the next presentation next. So we have 2 presentations. They're about 15 to 20 minutes each, and there'll be room for Q&A after each one. And who's presenting first? And so the first presentation is by Dr. Greg Wellenius, who's very kindly offered to talk about working across fields and bridging the gap between geosciences and health sciences. He's also one of the members of HEI's research committee. And so if you have questions about applying for funds, he's someone else who you can talk to. And so take it away, Greg.
Super, thank you. Great. Well, thank you to the organizing team for inviting me to speak. I'm really excited because I'm actually getting really passionate about this idea that health scientists are really good at talking to each other. And I think, you know, I'm in that community. And I think from what I see, geoscientists are really good, or natural scientists more broadly, really good at talking to each other. And there's often not as much crosstalk between the disciplines as I think would be productive. So I'll talk a little bit about that today. I will tell you that, as Allison mentioned, I am on the research committee of the Health Effects Institute. So just keep that in mind as I make my comments. I got to tell you, and they didn't put me up to this, actually HEI is one of the best organizations you could hope to work with. So either as a grantee, or if Allison and team asks you to review for them, being a occasional like ad hoc external reviewers, how you sort of get vetted to become an internal member of the research committee. And it's actually a fantastic opportunity. I can't imagine one of the more satisfying external engagements that I have. All right. So I hope you can see this in the back. So there's some differences. You know, I thought I'd just start out by what's the differences between people in the health sciences and the natural and social sciences. So if I say geosciences, that's, you know, including, you know, that, you know, we can think of that also in the broader buckets of natural and social scientists. And you know, why don't we work more closely together? And it starts out with, we just have different disciplines. So my training is in epidemiology and environmental health. I have good friends that are in biostatistics. I work with lots of people in our departments. This is at BU. We have a department of community health sciences, health law, policy and management, global health. Each institution has some different names for these types of departments, but this is the range of expertise that broadly exists at schools of public health. And on the other hand, when I look at my colleagues on the Charles River campus, I work with folks in earth and environment, in biology. They have a joint biogeosciences program that spans biology and earth and environment. I work with a couple of folks in sociology and math and statistics. And so each of these disciplines, of course, has their own fields, their own jargon, their own sort of cultural norms, including of where we publish, where we typically get grants. So I'll just touch a little bit on that. You know, one of the important differences is our funding model. So, you know, my salary is the school, and this is pretty typical across schools of public health. My school pays 10% of my salary for existing, showing up, answering emails, and then another 20% for teaching, and then the rest is extramural support or administrative, heavier lift administrative activities. I direct a center that covers a portion of my salary, and the rest comes from external research funding. In other schools of public health, the balance might be different of exactly how much you get for teaching or how much you get for service activities. But broadly, you know, it's a soft money environment where the majority of your time is funded by external research grants. Others, Young is in the School of Public Health as well, I'm sure. The funding model there is slightly different, but the idea is the same. Whereas I understand from my colleagues in earth and environment in particular that, you know, research is an expected part of their 9-month salary. So they're paid 9 months. They're expected to do some teaching in exchange for that and a lot of mentorship of students. And research is part of that. And then this is, you know, trickles down to what our funding agencies expect. So most of the public health dollars come from the National Institutes of Health, from NIH, where we charge direct salary costs. So on a grant, I'll budget myself for 10, 20, whatever percent on that grant. Whereas my colleagues on the Charles River campus say, oh, can you cover, you know, 1/10 of a summer month for me? Like, sure, 1/10 of a summer month is not that much money. We could do that. So huge differences in the funding criteria. Funding models, both at the institutions and with where we're primarily getting our financial support from. There's also a huge difference in who we train. So most schools of public health do not have an undergraduate education program, at least not a sizable one. There are exceptions. So, you know, our primary, you know, bread and butter is really training master's students. So I think at BU, in the Masters of Public Health program, we have something like 400 students per year. So it's a sizable program, and that brings in revenue. That's revenue generating. That's where, you know, the portion of my salary that goes to service to the institution comes from. And then we also have a large number of doctoral students, not nearly as many. Our department, I think, has about 4 or 5 per year. So maybe about 25 at a total time point. This is really different than in many of the natural science departments where, you know, the primary bread and butter might be the undergraduates with, you know, some number of perhaps growing number of master's students as a new source of revenue and fewer doctoral students. So these are really important differences. And then the institution inevitably gets in the way of effective collaboration across campus. One, we're physically separated. Many universities, the School of Public Health is located on a different campus, typically on the medical campus, which tends to be separate from, you know, the main campus. We don't call it that because that makes us feel diminutive, you know. So it's the Charles River campus, the other campus. But physical separation matters even in this time of Zoom. You know, meeting people in person, having a cup of coffee actually makes a difference. And there's a complicated, you know, formula for how indirects flow. If I get a grant that goes through the School of Public Health and I collaborate with somebody in a different, you know, unit on campus, there's arrangements of how the indirects flow. And although I don't worry about indirects, and the investigator shouldn't have to worry about indirects, it's true that your department chair and your dean actually care very much about where the indirects go. So there's institutional barriers. There's also, I mentioned the difference in jargon, but there's also differences in what we expect when I'm on the thesis committee of a student in Earth and Environment. That's really different than the thesis committees for students in public health. So really different cultural norms. So that's just to say that there's some challenges. Okay, so let me back up a bit and tell you what is public health. So here's two definitions grabbed from the source of all wisdom, the internet. So the American Schools and Programs of Public Health and the APHA, the American Public Health Association, have these two different definitions, and broadly it's to protect and improve the health of individuals, communities, and populations locally and globally. So the next slide, this is too small to see, but there's a bunch of action verbs here. We have to assess and monitor the health of populations, investigate, diagnose, and address health problems, communicate, inform, and educate, strengthen, support, and mobilize communities and individuals, create, champion, and implement policies, improve and protect the public health, enable equitable access, create a skilled public health workforce, improve and innovate on public health functions, and create strong organizational infrastructure for public health. So this is, deliberately sort of action-oriented. There's like the health of our families, ourselves, our neighbors, our communities, our cities, our countries, the world, and you need an infrastructure. You need to identify what's the problem, what's keeping people from being as healthy as they could be, and then, be very solution-oriented. Not everybody does every part of the puzzle. There are public health researchers that never form a community partnership, and that's totally okay. And there are people that are very much practice-based that do little sort of in the publishable academic research space, and that's totally fine. It takes all everybody across the biomedical workforce to make this happen. And there have been substantial gains in public health over the last 100 years. I mean, COVID is a great example of the development of a vaccine. The rapid, termination of what could have been a much, as horrible as it was, what could have been a much worse pandemic. Hopefully we've learned something to be better prepared for the next one. But even, lead in gasoline, lead in drinking water, still a huge problem. Drinking water through lead service lines, but huge gains. If you look at the gains in society in terms of both life expectancy and addressing each of these problems, it's been incredible. Okay, so I'm not going to go into detail, but broadly in epidemiology or in sort of the study of population health, the determinants and risk factors for different diseases, there's really, you can think of two buckets. There's sort of those studies that are meant to describe a problem. What's how many people have asthma in this population? How many people are obese? So very descriptive. You can think of prediction modeling. So these are the studies that are trying to guess who's going to get sick. You are building a black box. You don't necessarily care about whether it's etiologically or causally related. And then there's, trying to identify the predictors of disease in a way that allows you to intervene. And so we'll think of that as the etiologic research or your causal research. It's what causes this disease so that we can remove that cause or ameliorate that cause and reduce the burden of disease. And so when we think of etiologic research, which is just one of the three buckets I just mentioned, you can think of the life cycle of those studies as starting by defining a really great research question. And, a lot of times people gloss over this. I'm actually going to spend a couple slides talking about this, and I'm not going to talk about the other parts of this because we have a limited time. But you got to start with a really great research question, design the study in terms of lots of different criteria, which I'll touch a little bit on, collect your data, analyze the data, make friends with biostatisticians and others, wherever they are, evaluate your results to say, what are the possibilities, other explanations for my results besides the causal relationship, and then assess generalizability, by which we mean to who do these results apply. If you studied only men, do they study, those results also apply to women? If you we're not allowed to do that anymore, fortunately. If you study only a particular population, who does it apply to? So I'm going to start, and warning, I'm going to ask you guys a question now. So typical headline, eating red meat is linked to type 2 diabetes risk, new study finds. What's wrong with this headline? So it's a fine headline, but what's wrong with this as a hypothesis? Does eating red meat cause type 2 diabetes? What's wrong with that question?
Tricky.
What's that?
It's tricky.
It's tricky. It's a hard question.
Very
Okay, so I had
general.
steak last night. So should I have diabetes tonight? So over what time frame might be one question you might ask. I heard another one. What was it?
It's very general.
It's very general, exactly. And it's, it turns out that we have to eat something. So one of the big questions is compared to what? Okay, so my favorite are the many of the studies of diet. It turns out the epidemiologic community is really good about telling you what not to eat. And what's left? It's like a bunch of walnuts or something, right? And so there's not, this alone doesn't tell you the contrast of interest. So does eating red meat how many times a week? For how long? Like, one night or, for over a 5-year period versus what? Versus eating, being vegetarian might be very different than being vegan, which might be very different than eating, 100% sugary, desserts, right? So, even within the bounds of reason, we need to have a counterfactual, and I'll tell you a little bit about that. It's really important on the timing as well. So if I ask you, is exercise good for you? How many people say exercise is good for you? Okay, good. Does anybody want to disagree with that assertion? Yeah, tell me why.
If you exercise so much that you get injured, that's not good for you.
Oh, good. So exercise, what you're getting at is that exercise has a long-term benefit, but actually poses an acute risk. While you're out actually exercising, you're at greater risk of injury. You're also at greater risk of a heart attack for the hour that you're exercising. And that's particularly true if you almost never exercise. So, so the timing of the exposure and the outcome and their relationship really matters. So this is just to give you an idea into the nuance that's involved in asking the question properly, which unfortunately is a step that a lot of times people skip. So when you think about the counterfactual, you have to think about, how do I take a group of people that are exposed to something, let's say long-term exercise, so chronic exercise, regular habitual exercise, which we think is beneficial. And the question you want to ask is very specific, is what would happen to those people that did exercise if they had not exercised? Okay, so we can't ask that because we don't have a time machine. So we can't go back and say, what would have happened to the smokers had they never started smoking? But that's what we're trying to get at in the causal contrast. So what we try to do is find a population that's just like the people that smoke or eat meat or exercise, but don't do that thing. And in the ideal setting, we have a randomized study where we can randomly allocate exposure, and the outcomes are on average the same in the population, whether they got the exposed population is on average the same as the unexposed population had they not been exposed. So we call that exchangeability. And so that's like the magic of population health studies, okay? It's, when we're trying to identify the causal basis of the world, we're trying to compare to what would have happened had these people that were exposed not exposed. But to do that, we have to define these terms, like what do we mean by exposure? Over what time frame? What's the causal contrast we're interested in? Okay, so here are just some aspects of the causal contrast. Who are you thinking about, when, where, why? So it might be people discharged from a hospital, or it might be people, that were pregnant. And so it might be, you really have to define that source population. The exposures are many things that you're all really good at estimating, things like air pollution, climate hazards, built environment, a lot of things we can derive from satellite data or from, increasingly from aerial imagery, from Google Street View, cars, et cetera. And similarly, you have to take the same amount of care with the outcome, but the outcome is a broad term for the marker of health, well-being, or disease, or behavior and an attitude. And again, the time matters. When we think of, is something associated, is cell phone use associated with depression? Maybe amongst teens. I have teens, so I think about this a lot. And again, you have to ask, the question, timing is really important. Are we thinking about a moment of depressive symptom, or are we thinking about long-term chronic depression? Those are two really different outcomes that require different study designs. So I want to celebrate the type of work of why we in public health need those in geoscientists. Those are good at doing things that I'm not as good at. So this is work by a now faculty at the time that this was published, a research scientist in my group, Keith Spengler. Keith is relatively unique because he graduated from Brown's Department of Earth, Environment, and Planetary Sciences, so DEEPS. And he's a card-carrying geoscientist, but he had me on his thesis committee because he also wanted to get the public health flavor. And he spent, on and off, so months of real time, but spread over a couple of years, taking much of the data that we in public health need, which is we have health data usually at the zip code level or on large population-based data sets, either at the zip code level or at the county level. And so there's all this fantastic, satellite data and weather model data. But I can't use it on a raster of 12 kilometers. I need to be able to link it to the health data set, which is on a different spatial scale. And these things are not always offered on the same spatial grid, right? So PRISM and DayMed and ERA5 actually on different spatial grids. So like, how do you actually downscale these data to the same grid? So lots of work, and now these data are publicly available. He's archived it, so anybody can use it. So this is part of the way that geoscientists can help. Here's another quick example of successful collaborations between geoscientists and health scientists. This is some work by friends of mine, Patricia Fabian and Lucy Hutira, both at Boston University. And this was about thinking about cooling supply, as in the built environment, in particular greens, trees, and the cooling effect they have on the city. But is that matching, or what's the mismatch between the cooling supply and the cooling demand, where people are living, and not just any people, but the most people and the most vulnerable people? So thinking about cooling supply and cooling demand gives you this new insight into, do we have, where is sort of the most action needed in terms of providing, whether it be urban modifications or health support. Okay, so how do you bridge the gap between these two fields? First and foremost, you got to spend time together. So it turns out, because we all use different jargons and have different priorities, you got to start by being, close colleagues, if not friends. And then you'll learn to speak the other's language. You can attend their seminars and events, take a class in a different discipline if you're still a student, read the papers of your colleagues in a different discipline, collaborate, and including, in the BU has a urban program run by Pam Templer in biology, and Lucy Hutira in earth and environment, and John Levy in environmental health. And it's a great example of sort of this multidisciplinary training for the next generation of doctoral students. I'll touch quickly on CAFE, which is our research coordinating center of the NIH Climate and Health Initiative. I'm sorry. And CAFE is seeking to convene, accelerate, foster, and expand the community of practice around climate change and health. This is, you can see involves a number of people at both BU and Harvard. If you're not already a member, I encourage you to scan the QR code, or I'll give you a link, URL at the end. And this is really, again, to bring the community of practice together. We have efforts around data, around sharing of expertise, sharing of data, and capacity building. I'm very excited to announce that NSF has recently funded us to create a research coordination network that we're going to call GeoCafe. And this is led by me with Lucy Hutira and Dan Lee, both in Earth and Environment at BU. and a large network of supporters from experts in the geosciences. And the idea here is to build on CAFE, which is funded by NIH, but to build that so that it more deliberately helps recruit and interface with folks in the geosciences. And our basic premise, because research coordination networks include a lot of money for travel. And so we're like, okay, how do we really do this well? So if you're in the geosciences, you probably go to AGU every year, or maybe you go to AMS. And so what we're going to do is recruit a cohort of geoscientists and say, hey, in addition to going to AGU, which you're going to do anyway, so you find yourself on that, but would you also come to one of the meetings that the health scientists frequent, whether it be the International Society for Environmental Epidemiology or the American Thoracic Society meeting, lots of meetings that we go to as public health people, come to one of our meetings and hang out with us. And similarly, we'll take 5 or so health scientists and say, hey, you're going to go to ATS or ISEE anyway, but would you go to AGU this year too? We'll pay for you so that, and then we'll have some events at AGU in order to facilitate. So we'll have some virtual events and to connect this cohort, keep them connected to each other. Hopefully they make friends, become colleagues, collaborators, and start by mutual understanding through shared experience at each other's meetings. So some of the in-person events we're planning as part of CAFE and then supplemented by GeoCafe. The International Society for Environmental Epidemiology is going to be in Chile in August. Climate Week in New York City, we're not exactly sure what we're going to do, but I think we're going to be there. NIH is excited to be there with us. The American Public Health Association meetings in Minneapolis in October, we're having a breakfast there. The Association of Schools of Public Health in Africa is having a meeting in Zambia in November. We hope to be there. And AGU in December, we've applied to have a networking event there that Susan Annenberg, I think I haven't seen yet, is helping us co-lead there. So look for us at these in-person events, as well as, once you get on our email list, our many virtual offerings. So let me pause there. I probably went over time. So we'll hopefully have a few minutes for questions. If not, you can reach out to me. There's my email. To get on the CAFE email list, you can go there or email us directly, and we'll get back to you. So thank you. Any questions? Yes, sir.
Yes, David Maroney at Jet Propulsion Laboratory. Thank you for your talk. It's very cool to see. So I come from the atmospheric sciences background, geosciences background, satellite remote sensing mostly. So it's cool to see that this is all being done. I'm just curious, from your experience, where's the biggest thrust coming from to do this gap bridging? Are you seeing it mostly coming from the health sciences side, or are you seeing an equal weight coming also from the geosciences side?
So I'm not 100% sure yet. I think that there is resistance on both sides and there is appetite on both sides. And so, in life, I guess philosophically, I try to bring together the coalition of the willing. So the fact that there's enough interest that NSF actually was a huge supporter of our application and, have been proactively engaged since. And I think we ended up with 14 letters of support from leading experts in the geosciences community. So I think there's lots of appetite in the geosciences community. I think the health community, one of the challenges, self-criticism, one of the challenges in our field is that often we think, yeah, we need people in the, earth sciences to make us data sets. And, like there's a sensitivity, like the earth sciences are not a service corps for public health sciences, right? This is about creating meaningful collaboration to actually be able to achieve things that neither of us can achieve on our own. Because that's the only way we're really going to advance the climate and health agenda is by taking the experts that contribute to both the climate side and the health side and bringing them together. I've been coached and asked to indoctrinate everywhere I talk that we shall not refer to people as climate scientists, because people do not want to be called climate scientists. They are earth scientists or atmospheric scientists or subdisciplines, but people by and large don't want to be called climate scientists. So I've been trying to be very careful, and I encourage you to do the same. This is the geosciences community, or earth sciences community, and I defer to the experts in that field to correct me if I'm wrong. think there was another question. Yeah.
I'm also coming from the geosciences, but I've seen from air quality studies, especially like PM2.5, health effects will kind of be tied in at the end of the study, usually with an exposure dose response function. And I would be curious to see how you would envision something similar framework, but how that collaboration between disciplines could be made to provide more substance.
Yeah. Okay, great question. So the question, just to summarize for the online audience, is really like in the end, a lot of these exposure type, or what we think of exposure data sets are sort of brought in, the public health folks might be brought in at the end and say, now use this for health. Can we do something smarter than that? I think that's the essence of your question. And, absolutely. So for example, when we think even of modeling urban heat, there is, if you think of it right from the beginning, the question is, what's really the variation that's important? If you have health data, if you want to look at the impacts of health on the impact of heat on people's health in a city, do you only care about the temporal variation? In which case, a data set at a 4-kilometer, 12-kilometer resolution is probably fine because you're taking the average exposure across the city and saying, okay, look, today was hotter than yesterday, more people died today, how many more can we quantify that? On the other hand, if you're trying to look at intra-urban variation in heat, then that 12-kilometer data set is not useful. So working together at the beginning to say, here's the question we're trying to address, then let's, those with the expertise in quantifying the variation that matters based on all the wonderful products that are out there, with match to the health data at the resolution that matters for that study, is really much more productive than saying, oh gosh, I have this health data now, could I use the, Prism 4-kilometer data set? Well, maybe you can, depends what you think the actual spatial variation of your exposure is, and you have the health data to match it. If my health data is at the county level, then, having 30-meter resolution, NDVI doesn't help so much, right? So I think that going back and saying, what's the real question I want to answer? And why is that question important to a policymaker? And then how can I answer it working together as a team? How can we answer that to make that evidence relevant, actionable, and timely for the policymakers?
Yeah. It seems to me that there is a data pipeline, and the geoscientists, they are always in the upstream side, so they provide the data, and so the data can be fed into the health models, so the health community can use that data to do further studies. So apart from this, do you think there's other cooperation modes or that could exist between these two communities?
Yeah, great question. So the question was really, can we have more than sort of two separate, like I have my data, you have your data, let's bring it together. And this example I mentioned from Lucy and Patricia is really a great example of even conceptually. It's in public health we worry a lot about the health impacts, but then if we want to think about what do we do about it, then this idea of matching cooling supply to cooling demand is really what drives policy, and neither side on its own is enough. Like just saying, look, here's the deficits in cooling supply. It's small, but you can see sort of where cooling, there's a lot of green space in Boston in some parts. And so you might say, okay, well, we definitely have to focus our efforts here. But it turns out if nobody lives there, or if that's not a particular, if everybody there has air conditioning, maybe it's less of a big deal. And so even this notion of let's think about it as a cooling supply and demand, I'm convinced that a paper like this and the insights that this derives does not happen without this sort of bridging type of collaboration. Okay, great. Find me at the breaks if you wanna, my outsiders take on HEI and how you can get engaged or anything about Cafe or GeoCafe. Thank you very much. And let me introduce my colleague, Zach Pop. So on the agenda for today was supposed to be my colleague, Kevin Lane. He was going to speak. Unfortunately, he came down with something overnight and was in such a state that you actually didn't want him in the room here with us today. And Zach very kindly this morning agreed to step in. Zach is a research data analyst that works at the Center for Climate and Health at BU and has a lot of expertise in spatial methods. So Zach, take it away.
Thank you, Greg. Want to give thanks to Kevin, who put together all the slides for today. Unfortunate that he couldn't be here, but I know his contact information is also at the end of the presentation, and he's a really great resource for any questions relevant to this important topic. So this first piece, I think, touches on a topic that was already brought up in Greg's portion here, but there's two primary methods for digital storage of these GIS data. And this represents one of the big areas where there is this divide between the geosciences and the health sciences. For the geosciences and the satellite data that is available, it's typically being stored at a raster level, which is great because of the temporal and spatial complexity that can be stored within that data format. In the health studies, almost all of the work is done with vector data, whether that's points or polygons. Points might represent residential addresses that are available from a cohort study of participants who agreed to share that information for analysis alongside environmental variables, or at the size of polygons. So that might be a county or a zip code, or a smaller area that's available to characterize the neighborhood that someone lives in. But this divide can be complicated because a lot of the individuals who are working with these vector data don't have familiarity with raster data, with ASCII2 files, or with GeoTIFFs, .cdf files, and the size of those files can be intimidating and can lead to collaborations that would be really interested in using this health data not occurring. So this is a really important divide, and we'll talk a little bit more about how this can be addressed. In terms of what's being used in public health, it's really these three satellite products. MODIS for NDVI data, VIIRS for light at night, and Landsat 8 information for NDVI, also impervious surface areas, and land surface temperature. This is an area where collaboration would be important because I think in the health community, there's not a lot of awareness as new products become available that might be more spatially resolved or have more temporal resolution that would be really useful at expanding on the analyses that have already been done with previous products. So that's a great area for collaboration and identifying new resources that could be used to extend what's already been done. For collaboration between geosciences and health science, one area where there has been great collaboration and where there's it could be a great entry point for early career investigators is in air pollution. And one of the reasons for this great overlap is that there is a shared interest in that biostatistics portion of the health sciences and in the geosciences, in machine learning, and in applying these new novel analytic methods at taking data down to the level where it can be analyzed and impactful to policymakers or used in health analysis. The example here is an example of great collaboration that happened in India to classify PM2.5 at a 1 kilometer grid across the country. And you can see this is from 2008 through 2020, and they explored the temporal variation over that period and have now taken the PM2.5 data down to the district level so that it can inform policy moving forward and be used in health analysis. Another area that's growing and that's been used for these satellite-based analysis is in green space. So greenness, if you're not familiar, very well named exposure because it just represents the amount of green that is in a neighborhood. That could be in the form of trees, other plants, forests, parks, and in gardens. And it's important because it's been linked to as protective for several health outcomes. That includes improvements in birth weights and physical activity. Having an area nearby where someone can exercise can be helpful for physical activity. It also has been linked to improvements in mortality and linked to mental health in the form of depression and depressive symptoms. Also noted here, there's inconsistent results for allergens and asthma, which also might be expected given that it's a characteristic of the local plants in the area that produce pollen. So NDVI is indicating these photosynthetically active vegetation and ranging from -1 to 1 with positive values indicating that there's a higher vegetative density and more greenness. One of the great benefits for this measure is that it's consistent across the globe. If you're measuring greenness in Boston, it's the same approach as in Chennai, India. But one limitation is that it's non-specific and that we're talking about trees or grass or shrubs. It's just greenness as an umbrella term, and each of those different components might not have the same relationship with health, and understanding that's important. Giving context behind these really highly resolved satellite-based measures is really important for having an effective health analysis. Another challenge in using this data for health science is that it can be difficult to interpret. It might be daunting to an investigator to use a unitless measure that goes from -1 to 1 as a scale, and that might be best translated as percentile differences across an area. Here are some examples of some work that's been done with green space and NDVI. You can see one example analyzing across metropolitan areas in the US, the effects on mortality, but also using the same measure globally in Seoul for urban vegetation and heat-related mortality, but also in academic performance in analysis in the global south. Here highlighting that those changes that occur in resolution are very important. So at the top here, you see a 30-meter resolution image, and not sure if it's easy to read on the left, but just looking around our backyard in Boston at the Boston Common and Botanical Garden, and having that higher resolution data gives a much better idea for where this level of greenness, where this park is actually located, as opposed to using MODIS data at 250 meters, which is a lot more abstract. And this is really relevant when you're taking these raster data and aggregating them to something like a county or a zip code or a much smaller level of aggregation like a census block. And those census blocks can be useful because they might be used to characterize within a county how much of the population is actually exposed to your measure of interest. So in this case, greenness. So just highlighting, as there are more spatially resolved data, they can be very impactful in terms of the actual association that you see in an analysis. But also, as Greg mentioned, that's dependent on what you're analyzing. So if the only spatial data available is at the zip code level and there's not some smaller resolution, then having the most defined data that's going to be very large and expensive to use for computing might not be worthwhile. As I mentioned, it's important to recognize that the satellite-based measures are only going to be relevant towards health when given the proper context around what they actually represent. So taking green space as a measure of access to parks, it's important to recognize that just having an area that is green that's nearby doesn't mean that it's actually being used. The example here is the images are showing service areas and a 5-mile drive, I believe, in terms of access to a park. This can be done also for walking distance to a park and can be a really useful measure to characterize who has access. But it's important to recognize that doing these service area networks and understanding how close people are is very computationally intensive. And to do it at scale in particular might be infeasible or more expensive than is really responsible. In addition, for parks, in terms of just greenness, that's one measure that is really a blanket term, but parks also are composed of what's inside of them. So there are some databases that aim to characterize those different characteristics, but including amenities and I'm not too familiar with these databases, but might be like, is there a playground accessible or is it just a patch of grass? And those are going to be distinct to whether there is a benefit. However, those existing databases are often updated infrequently and may be inconsistent over time. And here is an example of taking this to another level in terms of analyzing human behavior against these measures of green space. And this is a product of a collaboration with Google where anonymized and largely aggregated data from Google users was used to define park usage based off of the proportion of the population within one of these census tracts that visits a park at least once in a week. And this is, again, important to recognize because even if someone is within a 5-mile drive or a 10-minute walk, it doesn't mean that they're accessing that resource. It doesn't mean that they're going to the park every day, even though it might be easy to make that justification because you have a fancier measure that says that this is how accessible it is. But having smartphones that are widely accessible and that can be used to characterize human behavior is really valuable at getting these more defined measures of whether people are actually using these resources. Notably, this is not necessarily generalizable. It's based off of smartphone records, which are going to be limited in terms of who is using that resource. And also, this is something that's clearly novel in its application and isn't necessarily going to be able to go back to 1950 and say how many people were using parks. This is an extension on that work to analyze how the usage of the parks related to travel time. So on the x-axis here, we have increasing travel time against the proportion of the users that were visiting parks. And you can see that there is a trend. On the left side, you have 2019, and on the right, 2020. But it's not necessarily the very strong trend that we might expect. People who are living very close to a park, as compared to those who are living up to, say, a 30-minute drive away, don't have as different of a relationship as we might expect. Here we see the trend going from about 30% of the individuals down to about 10%. But we also see the differences between 2019 and 2020, which obviously is related to the major events of 2020 and the pandemic and how that changed people's mobility and how they access the resources that were near them, where they might be more expected to be within a defined area as opposed to traveling a greater distance outside of their neighborhood. So in summary, these are a very valuable tool in terms of the remotely sensed data, and they've been used in the case of greenness to do these robust health analysis with a wide range of health outcomes. But it's a growing area. There's new exposure metrics that are coming up over time. And having this additional context around the measure is very important for increasing that health research. And that involves a combination of these remotely sensed resources, but other information that's at the vector level or otherwise to further contextualize that exposure. Here's an example including greenness, but also a lot of other satellite data that's relevant for health, including temperature, noise, and PM2.5 here. And here analyzing against analyzing maternal exposure to these different elements as significant predictors of birth weight. Notably here at the bottom of the screen, it's also compared to economic residential segregation. And these economic ERS or racial residential segregation are really relevant and relevant in the environmental justice context. That's also very relevant to keep in mind in terms of that vector-based approach. A lot of these are defined based off of the census, which is going to be available at the census tract level, sometimes smaller areas, also larger areas, but aggregating these remote sense data up to that larger area is important for these kinds of analysis. Here, further describing that change in spatial scale. One thing that we've been doing a lot is analyzing that exposure data down to the block level so that population weighting can be done if looking at the county or the zip code level where often health data will be available, whether that's for Medicare or Medicaid or somewhere else. Using blocks as the basis and understanding exposure at that level, and then characterizing based on the number of people that live in that area as opposed to across a large area like a county can be really useful at having a more well-defined exposure metric. And this research and doing it at this kind of more aggregate level is not only useful for matching to the health information, but also for impacting policy. This is an example of the work that Kevin's previous PhD student, Paige Groshue, had done in analyzing a few different factors in line with heat adaptation planning, looking at constructs of the natural landscape and then breaking it down into things like greenness and impervious surface, and understanding where there are areas that might be targeted for intervention at the city level to do this work at improving communities. And here's an example that was done in partnership with the Chicago Tribune to build a data dashboard that could be used by the community and by policymakers, again, to understand where are there urban heat islands within the area and where is there a need for things like cooling centers. You're using land surface temperature and albedo alongside green space again, and as well as factors related to cooling centers, so that you can understand where would be the best place to locate these resources that might be a haven for people in the community in those very hot days and hot areas. And this work has also been extended to that work with PM 2.5 in India, aggregating PM 2.5 to the district level for analysis with policymakers, researchers, and the general public. So in summary, the publicly available satellite data has allowed for high resolution characterization of climate, environment, and social determinants of health, but it's done so along with novel field methods and bringing in new approaches to further contextualize that data. Access to data at fine resolutions can be difficult. This is true particularly for, say, like residential address data, which is really great because you can characterize specifically the area around an individual, but that's a lot more information about someone than the county that they live in that might be broadly available. Also, when characterizing exposure, it's important to recognize that there's different approaches, and having the correct spatial or zonal statistics being explained in some cases are going to be very important for applying correctly. Dashboards can be a really helpful tool for engaging with stakeholders and making data more accessible, not only in very complex forms, but in an area where someone can click through and try to understand in more depth what's represented by the data. And partnerships and collaborations with interdisciplinary teams can dramatically improve this health research. With the Chicago Tribune, I was working with a data journalist to understand what would be most useful for the community. And that work with India also has involved a good amount of collaboration. And the last note here is that sharing data in repositories that are accessible to end users can be the most useful element for furthering the life of that data. The fact that there's a high amount of computational power and time that goes into getting data down to these different levels is really relevant, and is in many cases not something that needs to be done over and over and over again. This is something that's really been a focus at BU, and understanding how these data resources can be shared as they're developed, as opposed to doing the same work over and over again. And now through the CAFE Center that Greg leads and has touched on previously, the hope is that that work also can be extended to the community of practice at large. So not only within BU, but sharing data at these aggregate levels so that they can be used, and also sharing knowledge, sharing how the tools that are used to process these data and to make them accessible so that they can be used more broadly. So thank you, everyone, and I am happy to take any questions. Any questions? Yes.
So you mentioned putting it into repositories as a great, so in your opinion, where do health researchers go first? Like what would be the preferred repositories, the places to work with data?
Yeah, I think it's going to vary from researcher to researcher. And one challenge for health in particular is that it would be great for health researchers also to share data in repositories, but that's really complex because of the privacy concerns. The CAFE repository is really a work in progress and is growing every day. And the hope is that that could be a convening place specifically for these aggregate forms of data. But it seems like in addition to that, it would be helpful just for health researchers to know where to go. I think that it's pretty spread out across CDAC or GE or other resources, and having some kind of informational tool at least that says this is where you can get this data, this is where you can get this other source, would be really useful and is something that CAFE is aiming to develop. Yes.
So I wonder the data set in your CAFE archive, are they like the raw data from the models or beers, or CAFE did some post-processing to those models and beers data sets and to generate certain products?
Yeah, so the CAFE, the current approach has been to have those more aggregate data forms. And I think that an avenue that we have talked about going down is storing some metadata for the more the data in a more raw format. But it wouldn't be somewhere where data that already exists in Google Earth Engine or on CDAC is being reposted in another area. It would be in taking that data down to a level where it could be used in health analysis or with environmental justice characteristics for that application. Yeah. Yep.
The metadata already exists in an openly accessible way. Do you automatically get that and archive and distribute that?
Greg,
yeah, so let me comment on that. So right now, CAFE has stood up a collection on the Harvard Dataverse, which is a separate, well-funded, long-standing effort. And our idea is that there's already several curated repositories with like really, you mentioned the one at Columbia. Google Earth Engine obviously has a ton of data. Esri provides a ton of data within their products as well. We were trying to create a ecosystem where it's easy for any of you, anybody in the field that wants to share their data under the FAIR principles to make it findable, accessible, interoperable, and reproducible. And so it's the aggregated data with the metadata, and there's the ability to have the code also that generated that. So for example, I showed you Keith Spengler's work earlier of that he created a number of heat metrics at the county level for a certain number of years. Well, what if you wanted to replicate that, but actually just aggregate it at the zip code level or extend it a year? You shouldn't have to do all that work again. That was a substantial amount of work. There's the code is there, so you should be able to just pull the code and say, okay, now unfortunately data formats change over time. The interface to the APIs change all the time. So it's not like we can just hit a button and automatically update it, but it's at least sharing what's available. And we're not deliberately not doing a top-down curated. We're not trying to build the next big collection. We're trying to create an ecosystem that outlives all of us, that sort of just says people that want to share data or find data that's shared, here it is. Part of the vision of that, as Zach mentioned, is we don't want to repost data that's already posted somewhere else. So Dataverse allows you to have these sort of metadata cards that allows you to then, say the data is actually over there, go get it there. It'd be great if that was more searchable than it is. It's not bad, but it could be better. And it would be, we're working with NIH because NIH has a CORDS initiative that's similarly, but that's a top-down curated data set. And we're trying to make it so that you can see that data on the Dataverse, click on it, and have it pull automatically from the CORDS database. So we're working on those. It's painfully slow process because the APIs, again, are complex and changing. But that's sort of our vision for it, is kind of this public ecosystem rather than it's not our collection, it's the community's collection. Anybody can post what they want.
Can I ask a quick follow-up?
Yep.
Yeah. So for the data products that you're aggregating from external sources, what are your recommended practices for data citation for people who decide to publish in a journal? Do you recommend that they cite the original source, or do you recommend that they cite your source? Have you run into any issues where a user only cites your source, for example, and not the original source of the data?
Yeah, it's really hard because there's not good norms around that. So when, for instance, the Google data, where as soon as that paper is published, the data is already on the Dataverse and it has a DOI. So the paper is citable, the data set is citable. We hope people will cite both, but there's no enforcement mechanism, right? It's a community, again, of sort of building the trust. And to some degree, like we should cite, we got the data from here, here's the DOI, and the data are better described in this other original paper. So that's how we hope people will use it. But again, this sort of replaces the, I know somebody, so I'm going to email them and hope that they give me the access to the Dropbox or Google Drive where they have this data. So this is a step better than that, but it's still based on trust.
Last question, I promise, last question. regarding citations. So one of the big differences that might exist in the realm of the geosciences versus the atmospheric sciences is a lot of the journals now on the geosciences side, AGU being a good example, are starting to require a DOI before you can even have your paper even be considered for being peer reviewed in that process. Is that same, are you seeing a similar trend in the health sciences journals?
So there's some overlap in the journals in that we all publish in. And so, all the nature journals make you have like not nature, which I don't get to publish in, but all the sub-level journals have data access availability statements that are required even at the time of submission. So whether it be actually a DOI or saying, I'm going to make all the data available, or here's why I can't, Zach mentioned the health data. So, we couldn't, or if it's proprietary data, we can't make everything available, but at least being very clear about what is available. And if you can't make it publicly available, why not? Great questions.
So the coverage of your data on the CAFE is the US based only or it's global?
No, it's global. Again, it's an ecosystem. So we're not policing what goes on there. I mean, we do have an approval process just to make sure that, we sort of people posting data past some minimum sort of thresholds for quality. But we're not, policing the data or the quality of the data. It's global. And, for example, some of the things that I think CAFE can do is we've been talking to a lot of researchers in India. We're starting to develop conversations in Africa. And, the computational power to do something like take the ERA5 data set and get the variables for, a particular city or a particular country is actually that in itself is a huge computational challenge for many people. And, like we have people like Zach that are really good at doing that and can do it pretty easily, but like, so could we even create like we might defy our ecosystem rule by, also adding some sort of curated collections and say, hey, we went ahead and got it for these 5 countries because we know that these 5 countries, there's researchers that are ready to do work but don't have the technical expertise and the computational power to take these global data sets and restrict them to a particular region. So that's the type of thing that I think CAFE can do to, catalyze that research. Broadly, it's global, and anybody can create a collection or request to create a collection. So, under the CAFE umbrella, which is meant to be broad and sort of everybody, but you could say this is the MIT data collection, or this is I'm going to create a separate air pollution, data collection. That's fine. The beautiful thing about credit is that you can divide it by infinite ways. It's still there. So, CAFE is not trying to take credit for any data that's there. It still belongs to the investigators, those that created it. It's a way of creating this ecosystem where we make the data easier for people to find.
And this includes health-related data as well.
So health-related data is hard because there's protection. So the health-related data that are publicly available, we can put on there, but then they're publicly available already. And if they're not already publicly available, the chance that we can make it available is near zero, because that's why it's not publicly available.
So I'd love to see this discussion happening. Now we're going to take a 15-minute break. Thank you to our speakers. I feel like that was very illuminating. So enjoy your break and come back and we'll have our panel. So,
Two things. There are restrooms on both floors. There are more downstairs and upstairs. There are also snacks. So just logistic-wise.
We did well.
Yeah.
Started and I
You said there are mics in the
Yeah, for the online audience, you're being picked up from the ceiling.
So if the back of the room can hear you, you're all good.
Welcome back, everyone. And the group's not going to be using a mic, so in case people in the back cannot hear what is being said, please let us know. So we'll try and figure out how to make that work. But welcome back. We heard from Greg and Zach about some applications, some opportunities, some challenges. And what we want to do in this final panel now is talk about those issues in a little bit more detail with a broader group of people. And we have an excellent panel here. So please think about all of the questions you want to ask. These are folks that have been working on issues related to satellites, air quality, health for a long time. So golden opportunity. But what I wanted to do first, just to get us warmed up and get going, is maybe ask our panelists a little bit about what they think is the one thing, when we leave the room, we absolutely must know about the use of satellite data for health studies in particular. And we're going to try and go in this order. So thank you for setting up that way. And as you do so, would also like you to give people a little bit of what you do, what kinds of work you do, where you are. And I will mention that Tracey and Arlene and Young are all HAQAST PIs, so they have been really thinking about this in a holistic way. But Tracey, I'll start with you. What is the one thing we absolutely must remember when we leave the room?
Okay, that's hard. Also, first, thank you, Pallavi, and hi, everyone. So you heard me introduce HAQAST a little bit earlier, but just to give you a little bit of background on me and my work. So my name's Tracey Holloway. I'm a professor at the University of Wisconsin-Madison, and my background is very much as an atmospheric scientist. I did an undergrad in applied math, and I got my PhD in atmospheric and oceanic sciences at Princeton, working with the NOAA Geophysical Fluid Dynamics Laboratory. But when I was doing my PhD, I was very interested in how an atmospheric science could be used for policy decisions. And when you're working in air quality, if you're interested in policy and you're interested in air pollution, really the connector is public health. And I realized that I didn't have enough of a background in public health to address the questions that were motivating a lot of my work. So I applied to be a postdoc at Columbia University, and my mentor there was Pat Kinney, who's now at BU, and working with the Mailman School of Public Health. And that was a really exciting project because we were using climate model data to drive air quality modeling, which was then used for health impact assessment. I think it was the first study to look at the health impacts of climate change through an air pollution lens. And so then when I was on the job market at Wisconsin, I was actually hired through an initiative on energy, again, kind of a policy atmosphere initiative. And now my work is a little bit of energy and a little bit of health, a little bit of climate, but a lot of air quality and a lot of models. And for about the past 10 years, I've been involved with the NASA HAQAST initiative, and I've been leading the HAQAST team since 2016. And so to me, one of the take-home points is really this idea that, kind of echoing something that Greg said, is that you need to actively connect with health if that is something you want to be part of your portfolio. Not all atmospheric scientists need to do anything with health, and not all health people need to do anything with the geosciences. But if you want it to be part of your brand, you need to take steps to build that expertise. And I think that the expertise is something that has to do with understanding the conceptual frameworks of these different fields. Like when a health researcher says they built a model, that is not a model the way that the geoscientist would think about it. And in fact, I've even, in writing kind of interdisciplinary papers, used the word model the way that health researchers use it, and reviewers have written back to say that is not a model, that is statistics. And I'm like, well, okay. Anyway, but there's a lot of issues in the health research community that think about things a little different than geoscientists. And so part of it is learning the terminology and vice versa. Part of it is learning the frameworks. But I'm motivated by one of the great questions that was raised earlier today about, is it just a downstream pipeline? Is it just, and I guess what I would say is no, because the questions that are motivating health-related research often come from the health research community. So you need the health researchers involved from the very beginning so that the question is structured in a way that leads to results that are relevant. And I think that this idea of this collaborative design of a study is something that is really exciting and inspiring. And not every idea that you have will be good for health, and not every idea that they have will be feasible or relevant or interesting to you. But if you have those conversations, it's a great way to be germinating new ideas. And maybe I'll just say one last thing. I know you said one, but I just want to say one more. One of the other questions was why, who's pushing this? Where's it pushing from? And I guess I would say part of the push is opportunity. There's funding at this intersection. There are jobs at this intersection. There are, the AGU launched the GeoHealth division to address this subdivision. So, you know, anybody who's building their career, you want to see where is their demand. And if you're all in this room, then you're interested enough to maybe be the people who may be meeting this demand that's out there.
It's always hard to follow Tracey. So I'm Arlene Fiore. I'm here at MIT. I've been here for just under 3 years at this point, and I and my group are your local hosts for the meeting over the next couple of days. So I guess I should give a little bit of my background. So since Tracey started with undergraduate, maybe I should as well. So my background is actually in environmental geoscience. So I guess I have that geoscience kind of label. And then I went on to do a PhD in atmospheric chemistry, where I worked on questions at the intersection of regional and global atmospheric chemistry and air pollution, with kind of some sort of tendency towards caring about it for health, but also with a connection to climate. And so been kind of at this interdisciplinary interface. Then I guess I followed Tracey because I went on to do a postdoc and then stayed as a research scientist at NOAA's Geophysical Fluid Dynamics Laboratory, where I really got into, it's kind of for those of you that don't know, it's a climate modeling lab. It's a NOAA lab. And so that got me much more into the core of the intersection between climate and air quality. And I guess there was always a little bit of like health on the fringes of the kind of work we were doing, and that I would work with folks who were doing health impact analyses with some of the model simulations we were generating. And then I moved to Columbia and Lamont Doherty Earth Observatory, where I was a professor for 10 years before I moved here. And that's where I really started collaborating more closely with epidemiologists. And so had to kind of navigate this, well, do you just want me to generate data? And then realizing, well, wait, there's actually some interesting questions in how do we get the information that you actually need? And so I guess my one thing that I'll emphasize is that I think many of you, at least on the geoscience side in this room, know very well, but that is that when we get satellite data that's relevant for air quality, it's not actually directly giving us what we want for health, which is what we're breathing. And so there's a lot of modeling that goes into how do we take what is actually measured by the satellite instrument and translate it to what we actually need in terms of understanding distributions of air pollutant exposures at the ground. And so some of these things that go in include taking into account the fact that different instruments have different vertical sensitivity. And so for the most part, what we're retrieving from space, I say for the most part, because there's some important new data sets coming out, but is a column. And so we need to understand how much of that column is at the surface. And there's different ways of doing that. There's, in the health community, we call it all models, right? There's statistical approaches, including land use regression models. So Yang is going to talk next, of course, has a lot of expertise there, as well as with the geophysical and kind of our air quality models where you can actually model the column to the surface. And of course, there's gaps in coverage. Depending on the type of instrument, we may not be able to see underneath clouds, which is for many of the things we care about. It's those kinds of instruments. So we can have gaps in our coverage. And so I think maybe I'll stop there and pass on to Yang.
Okay, thanks, Arlene. So my name is Yang Liu. Currently at the Emory University, Rollins School of Public Health. I'll also go back to my college years. So I was a civil engineering major in college. Graduated from Tsinghua University. Came here and did a master's degree in mechanical engineering because they require less coursework. And then continued to do my PhD at Harvard in environmental engineering. So I was an engineer through and through until my postdoc years. I did my postdoc at Harvard's public health, and that got me into kind of environmental health. So I got my first faculty position at Rollins School of Public Health. I've been there for about 15 years. So I consider myself kind of a black sheep in public health, total mismatch. I shouldn't be there. I've never learned toxicology, taught myself epidemiology. I'll never get an MPH degree. So I couldn't pass it. I might be able to do an environmental health PhD degree if they allow me. So my work is quantitative modeling, mostly using statistics and machine learning of environmental risk factors, and then try to assess the associations between these, between exposure to these environmental risk factors and different adverse health outcomes. And the primary health endpoints that I study include mental health, cardiovascular diseases, respiratory symptoms, and seasonal allergy and stuff like that. And Boston's allergy season totally got me today. It's like a month behind the Atlanta pollen season. I thought I'm fine, and then I can't stop sneezing today. So if I can say one thing about this message before you get out of this room, is that for early career researchers who are interested in geoscience, interested in public health, my advice would be take advantage of this lack of clarity, take advantage of this uncertainty and sometimes confusion. It's totally normal because the field of geohealth is very, very new. There are a lot of unknowns. We don't have textbooks in geohealth. We don't even have enough critical reviews in geohealth. That is because the field is very, very young. And the biggest advantage at this stage of this discipline is that everybody can make a name of it yourself. Don't be limited by the existing methodology, existing success stories. Carve out your own niche, and pretty much everything's possible. It's just the time for your imagination. It's a very exciting time to get into the field.
I'm probably going to be very brief throughout here, because I've already spoken and don't have that much else to say. But my name is Zach, and my undergraduate training is in health science. I then got a master's in public health, also at BU, focused in epidemiology and biostatistics. And I've been working in the Center for Climate and Health as a research data analyst. And a lot of the work that the staff in the center does is in that translation piece from the raster format and doing those computational changes, even if it's from already downscaled data into a vector layer so that it can be used in health analysis and running some of those health analyses. And we've had conversations in the past in the center about there's often a lot of interest in these data sets, and some folks might just want to have the data so that they can run their model and do their analysis. But there has been a focus on ensuring that it's not just giving access, it's also giving expertise. And I think that I would just encourage keeping that in mind, because I think that that's very important. And there's definitely going to be people who just want to grab a data set and start plugging in and using it. But you all are going to be a lot more familiar with the limitations that are related to that data, and making sure that the outputs that are coming from that are reflecting those limitations is going to be really important to ensure that the science is moving forward responsibly and effectively. So I think that would be my one big thing, is just important. Recognize your important role and be aware of what the outputs that are coming out represent.
That's great. Yeah, I'll be brief as well, because I spoke already. I did my undergrad and master's in physiology, and if you want to find a degree that doesn't lend itself to a job, those are it. So then I became a research assistant at Harvard, and fortunately had good mentorship. I was coerced into joining the PhD program, the School of Public Health, and I have my PhD in environmental health and epidemiology. And a recurring theme is my life is that then I didn't know what to do next. Fortunately, I again found good mentorship and did a postdoc in one of the Harvard teaching hospitals in cardiology. And that was really, I'm not a physician, but that was a really great way to really understand when we think about diseases, like it just became really important that you have to really understand those diseases. It's not good enough to just say, you know, we're going to measure a disease. Well, what do we really mean by that? What's a patient suffering from that disease really look like? And I think a thread then throughout my career has really been like, you know, the academic stuff is good, it's interesting, and it's partially rewarding, but it's like in the end, we're trying to like achieve something, we're trying to change something. So like, how do we actually go about creating change? And I won't stand up here and tell you I know the secret formula to change, but I do think I've done a good job of finding opportunities to work with people that are in a position to effect that change, and you know, joining that team. And I feel very lucky at BU that there's a number of change makers around me, and often they need data or insights or methods, and I have the opportunity to collaborate. And I think the one thing I'll leave you with is to, you know, collaboration across disciplines is so rewarding, I think, because it challenges you to think differently. I think when we are in our own bubble, disciplinary bubble, it's really easy to just, you know, I was taught that this is the way we do it, so we do it. And then you go outside your discipline and somebody says, huh, why do you do it that way? And there's nothing more humbling than having to say, huh, I don't know, but I could get back to you on that, and then having to think about it. And it's really important to like challenge the conventions within our discipline, and you know, hang out with an economist sometime. Like, you know, they challenge everything about what you're doing, and they're like, no, you should do it this way. And it's like, challenge them back. Well, why do you do it that way? And then it's through that kind of collaboration and new thinking that will really advance solutions to these existential problems.
Amazing. That was really helpful. And I think also illustrative in that it's not one particular degree and one particular type of training that will get you to this place. They've all come at it from many different sides. I would encourage you to, you know, think about your questions, but I'm going to maybe slot in one more before I get to all of you, which goes into this, you know, thing that Young just mentioned. You know, this is a new and evolving area, and there's a lot of opportunity for people. So if I can start with you, and then maybe, you know, hear from others. As early career investigators, what are the places and the ways in which people should be positioning themselves, the types of people you want to partner with, the types of places you want to publish, so that you are able to build a name for yourself and you're able to, you know, carve that niche, and maybe we'll have many other black sheep in the mix doing excellent work. But how would you encourage and advise early career researchers in particular to think about who to work with, what are the types of places where you publish, and how do you present that type of work?
Loaded question. So I assume I'm saying this to people who want to take an academic job, right? Or is that kind of fair?
Yeah, let's assume academic or research-oriented jobs, even if they're not necessarily a professor, they may be working at a research institute, working at NASA and wanting to do health. But people thinking about science and scientific questions generally.
Right. So I primarily deal with PhD students and postdocs. So I'm gonna wear my department chair hiring manager hat. What we're looking for is, I want to say two things: your productivity, number one, and your potential to be fundable. Public health is kind of a discipline that doesn't require you to publish your second paper in the New England Journal of Medicine. It doesn't really, honestly, I don't care about that. What I do care about is that you can demonstrate that your research will have an impact in your field 5-10 years down the road. Someone will recognize you as being an expert in your area. So this, usually public health is funded, like Greg said, primarily funded through NIH. Track record is very, very important. So you continue to build your expertise, get your name recognition, and I think that's the most important thing. Eventually, you will become fundable. People worry that, wow, how am I going to write my first proposal? Because I'm a nobody, and nobody knows me yet, the unknown quantity. But trust me, after you write your 5 papers in the same area, you become a known quantity. That's how we evaluate you. Can you go deeper and deeper to explore the uncharted territory in your field? Do you possess that capacity? That's very, very important. That means you're fundable because you can go further than anybody else. That's especially important for the NIH that you become the expert in the particular area. Yeah.
Wonderful. Arlene?
Sure. So I think you were, I was going to go in a different direction, but that's okay. But mostly just thinking about how do you build those collaborations if you are coming from the geoscience space and want to be doing more work on that interface with health. And so, I think being at this meeting is a huge opportunity for you to connect with many researchers at many career stages. And I was just going to volunteer that Tracey and I first met, I believe, at an AGU in 2001. Is that right? And, clearly we're still running into each other and working together. Now, this is not a geoscience health partnership, but the point is we met at a meeting. And we were kind of similar career cohort. And so it's not just about meeting the people senior to you, but also the folks who are at your peer network and potentially also junior researchers to you, right? At some point, some of you here are postdocs, you might be meeting graduate students who you can end up eventually working with. And I guess for those of you who are still in the training phase of your education, we were talking about, I heard both Tracey and Young say that they went for postdocs in, sort of this other area to grow this skill set and build that network. And so I guess those are my thoughts.
Well, maybe I'll build on what both of these insightful colleagues have said, because I think that actually what we're saying is moving in two different directions. Because on the one hand, Yang has said 5 papers in your narrow field, stay in your lane, stay focused. And then we're also saying, but meet everybody, build collaborations, learn new languages, do everything. And I want to say that actually, like, there is a balance there, and it's a bit of a dance. And I think sometimes as an early career researcher, it's easy to be aware of everything you don't know. And when I mentioned like, oh, I need to do a postdoc in public health. And during that time, I learned a lot about epidemiology. I learned a lot about running statistical models. I got out no papers whatsoever because actually the only paper I got out was with Arlene, our ES&T paper, but because I was starting back at the starting line, and it was not smart of me to go back and start at the starting line when I already had a PhD in modeling. Like, why did I do that? And so I think that like I learned some lessons because I'm never going to be the best epidemiologist. I mean, I don't have a PhD in epidemiology. It's not what I do. But I mean, at least I learned enough to be able to talk to people and to be able to like understand and think about things, but I didn't have to learn to run S+ or whatever to learn how to have those conversations. So I think there is this balance of, and sometimes we talk about it as a T-shaped discipline. That like you need to have what you're deep in, but then you need to have the connective tissue with other people. But that connective tissue can come through going and having a cup of coffee or chatting at a meeting or reading somebody's paper. And actually, sometimes that connection can come in fun ways, like working with somebody that you really like, that you would enjoy working with, or going and hosting a visitor from someplace else that you'd like to get to know their work more. And so, just this idea that it doesn't mean that you personally have to be able to run every method. And in fact, if you do try to do that, you might become, the Jack or Jill of all trades, which might make it harder to get the publication grant job that you want. So I think it's this balance.
Yeah, I think those are all really great comments. Particularly Tracey, I echo that. You need to have sort of, to some degree, especially early on, you need to be able to let people pigeonhole you a little bit into what are you expert in. Because if you're expert in too much, we've all been there, like you can't be expert in too much. So you need a certain amount of depth. And I guess the other side of that is, in terms of building your networks, is like nobody does science alone anymore. It's all team science. And, you need to be part of those bigger teams that are hyper successful. Like that's like success to some degree is contagious. And so being part of a successful team means that, it's easier to get that recognition. It's easier to meet people. It's also easier to find the resources. All the stuff we do now is so computationally and data intensive. You need resources for that. So, find those groups where you're going to get the kind of mentorship and support and resources that you need to be successful. And also then take a little bit of the time to explore what's going to be unique about you. What are you, no two of us are the same in terms of our expertise, or we're not exchangeable that way. Yang and I are both in environmental health, and like we couldn't be more different, right? And in our expertise. And that's okay, right? That's what makes us unique. So you got to carve your own path, but you need the support, a strong supportive network in this day and age to do it. And so find really nice people to work with.
Zach, maybe I'll modify the question a little bit for you, because you work with people at your center, and I'm sure others, they're all thinking about different questions, trying to look at data from their own perspective. So as someone who thinks about data all day, what are the types of things that you potentially come across that are helpful for this group to know in terms of how people talk about different types of data, how they think about using those data, and where have you found some common ground that can, help make those connections even stronger?
Yeah, I think that's a great question. I think one commonality is it seems like there tends to be a lot of interest, at least around public health, in terms of having an impact and seeing how research doesn't just kind of stay in a bubble, and how is it moving forward? Maybe not directly, but how does it move forward through links to other disciplines and move the field forward? And I think that there are just some general principles of making sure that the data is representative of what you hope it is, and you're fully understanding all the limitations therein before trying to jump to some conclusion about how it impacts a community or a larger area in a larger way. So I think that having those constructive conversations and having people give their input from their different experiences, whether they're if everyone has their own kind of niche that they're an expert in, making sure that there's a dialogue happening there and not being lost and only looking at things in one direction and being blind to all the limitations that might impact how that actually plays out in the real world.
Great. Okay, I hope that's got people thinking and questions. I already see some. So just why don't we start with an online question?
Okay, sure. So we have an online question from Devondra Paul, who asks, what are the key elements funders look for in proposals related to public health and air quality? Do they prefer solution-based proposals or reporting/awareness-based proposals? So in your experience, I guess.
Well, maybe I'll just start by saying I think it really depends. And I think when NASA is funding a health and air quality proposal, it is very different than when NIH is funding it or when HEI is funding it. And I think actually that is something that makes it a little challenging to navigate this space. When I was first starting out, I submitted proposals to a number of different agencies, and they all came back saying, this sounds like an EPA proposal. And I said, well, I've never written an EPA proposal, so I didn't know I was accidentally writing to that agency. But then I tried to learn, like, what am I saying that makes it sound like an EPA proposal? And just as an example, when I write to EPA, I talk about air quality and regulatory and policy relevant. And when I write to NASA, I talk about atmospheric constituents and atmospheric abundance and health relevant. And, you know, just this idea that you're sort of saying the same words, but you're framing it in a tone that suits different funders. So I'd say that there is not one size fits all, but just to be aware of the ecosystem.
I'll just add to that. I mean, every funding agency wants to feel like they're funding the most impactful science. But to Tracey's point, how you define impact actually varies quite a bit. And so understanding, you know, both what the agencies, what they're looking for in terms of that definition of impact and who's doing the review. So who reviews for HEI tends to be pretty different than who reviews for NIH grants, and really different than who reviews for NSF. And of course, you can find people that do more than one, but know your audience. If you're writing for an NSF audience, you have to have the jargon and the cadence and the appeal, you know, that goes with NSF, which is really, those grant applications are night and day difference from, you know, an NIH application. And so you just have to know the community.
There was a question.
Yeah, I actually had a question. It feeds nicely into that, what Tracey was just talking about. So my name is Kayla. I'm from the EPA's Office of Air Quality Planning and Standards. And I was wondering, it's a unique position with an atmospheric science background sitting in a policy sector, of how those of us in that position can leverage the research and data that you all have. And also on the other side, how do you use your research to aim towards what the policy needs and questions are?
So HEI, you know, to plug HEI does a wonderful job of navigating that a little bit, of sort of saying what is, you know, what are the research needs for policy and the policy implications of our research. You know, it goes back to sort of in the framing of questions around research. We can do things because they're interesting and or not mutually exclusive, but we can do things because they're useful. But if you want to do things that are useful, you gotta, you know, there was a good colleague of mine I was a visiting scientist at Google for 2 years, and you know, he used to say Google really wants there to be a catcher. It's like, if we're going to do this and we're going to create a data product or create some insight, who's going to use it? And talk to them at the beginning, not at the end of the process. And I think actually there's several people at EPA that do this really well. I think I mean, partly through my engagement with HEI, I see it, but also, separately I've, gotten to know Neil Fan a little bit. And it's like, again, it's like, let's do the science to inform the policy, but knowing which policy we're trying to inform and which question, if there's already like the level of uncertainty in that question's this much, one more study is not going to change the outcome. But if we instead focus on the parts where there's this huge uncertainty and we have ideas of how to reduce that uncertainty, maybe that's going to be the drivers of policy. But again, like I don't know where I know where the scientific gaps are, but I don't know which are the policy levers that we have to pull. So again, bridging those connections, it always comes down to people connections.
I was just going to add that I think, to build on Greg's points, that again, this two-way dialogue that we've been talking about, and this idea of like not just like a one-way sort of flow of information, that the geoscientists come up with something and then pass it over the fence, so to speak. But I mean, our experience, I think, as part of the HAQAST and HEI teams, is that sometimes we're doing relevant science as geoscientists or health scientists, but there's ways that information can be just slightly tweaked to make it much more relevant for the policy, whether it's implementation or standard setting or what. But the researchers don't know that if they're not having the conversations with the folks who are dealing with the day-to-day of the on the ground with the policy implementation or standard setting, et cetera. And so I think your question was also sort of about that two-way. And so I guess just like, seems like I keep it like common theme across our panel, but it's just the importance of those conversations in the early stages of kind of the study design.
Yeah, and maybe I'll just, say, I hope people know this, but I mean, EPA is an amazing treasure trove of data. We run EPA models, use EPA ground-based networks. I mean, EPA has so much expertise. EPA makes so much data publicly available because of its mission. I think that is really the backbone of a lot of the air quality research going on in the United States. So it's really great. I think that the flip side back about how to get research into EPA, I mean, of course, like 100% the two-way dialogues and the learning and the meeting and everything. I think the one challenge a little bit is that EPA is a regulatory agency. And so everything has to hold up under legal scrutiny and political scrutiny. And that's sometimes different than like, is it publishable? And so, I think one thing that's helped me is to understand and to learn from folks at EPA and who are the stakeholders that EPA is accountable to, like the state level air quality managers. They have a perspective on what they need to meet EPA's rules that is maybe a little bit different than what EPA or how EPA would narrate it. And I'd also say that for folks who are new to working with EPA, just to realize that EPA employees are living in this very litigious environment. So there may actually be things that they might want that they can't totally come out and put in an RFP or something like that. And so I think just to sort of, the more you get to know the ecosystem, like what are the nonprofits saying, and what are the lawyers saying, and what are the industry saying, and what are the environmental groups saying? I mean, just it all is very helpful. But one tip that came up at one of our HAQAST meetings, I think, was from Kirk Baker at EPA. And his recommendation to the tweaking was that why don't you consider, if you're a scientist and you're writing a paper that you want to be useful to EPA, why don't you send it to somebody at EPA before you submit it to the journal? Like, have them be like your friendly reviewer, because it's much easier for them to make those helpful comments before it's already published, if the real goal is for it to be useful. And actually, since then, I have sent him and other people at EPA many, many papers, and their comments are so helpful. I mean, it is so. I am a big fan of EPA.
Other questions?
So you mentioned the cross-discipline collaboration And from my experience, it is really hard to establish the first collaboration across disciplines. So I heard about doing a postdoc and working with, but I think I want to hear your successful story on the first step, because we know a lot of things like go to conference, meet people. This is not something we can learn directly. So I want to hear your successful story. Yeah.
I can jump in there. Maybe, sorry, I feel like I'm talking too much, but let me. So I feel like for those of you who are starting to mentor your own students, whether they're undergraduates, graduate students, postdocs, etc. Sorry, postdocs, I realize are not students, different category. But my interdisciplinary collaborations, once I was on the faculty at Columbia, they really were built around a co-advised situation. And so we were really fortunate at Columbia. We had this Earth Institute postdoctoral fellowship, which I think Tracey was on with when she was there. And so that was actually how, in fact, is Alex, I don't know if Alex, I won't call her, she left, okay. So, but basically it allowed me to, through somebody who was early career, to start to connect with my colleagues who were on very different campuses. In fact, in one case, we had 3 different campuses spanned, and yet we were able, through this postdoc who led the project, to start working together. And that was really exciting. So I think these things take time, it's slow, but that's one possibility, is through a specific project. But somebody has to be the lead in making these conversations happen. And in this case, or actually the multiple cases that I was fortunate to be involved with postdocs who were co-advised by me and others, they would make a point to go to group meetings in my group, in the other group, and then occasionally pull our groups together for larger meetings.
Well, one example is, I would say, I think writing a paper together is a great way to do it, because I know, I understand that many of us need funding to move things forward, and it's hard to do things unfunded, but it's very hard for your first time working together to be writing a proposal. I mean, that's a hard place to start. But if you start writing a paper together, and actually there's a very specific kind of paper, which is a review paper. And in fact, specifically a review paper for one of your audiences from the other audience. So for example, years ago, I wrote a paper with a health student at Columbia on how models could be used for public health assessment. And like, I knew the models and she knew the public health, and then we could write this paper. And it went into kind of a low tier journal, but that's okay. I mean, it got us working together and learning each other's, and since then, I think this idea of, a quasi review paper that you can write. And I think Arlene made the point earlier about working with people who are at your career stage, plus or minus. That really is a great way, because then you don't feel self-conscious about asking a dumb question. You don't feel self-conscious about like figuring things out as you go. You're both teaching each other in kind of a collaborative way. And then it ends up being fun. And then as you guys get older or more senior or whatever, then you have trusted colleagues in these other fields. And that's really something that is difficult to make as you get entrenched in your own university or whatever. But to have people that you've worked with all along makes just everything kind of flows more easily.
Other questions? I have one, maybe changing tracks a little bit. But at the moment in the previous session, we talked about a lot of different data sets, and they're available through many different platforms. And there's also new satellite data coming up that are starting to get used. So for people who are thinking about new areas of work, new questions that they can think about in the context of health, what might be some resources that they should be looking at? HAQAST is a great community. Are there others? Some of the satellite programs are also doing early adopters programs. And I don't know the extent to which the health folks are engaging in it, but are there avenues where people can go both for data, but also for this type of community and for meeting like-minded people they can work with?
Yes. I think that everybody here has their own community. In fact, I really liked hearing about Greg's CAPE and GeoCape as those kind of communities. One thing is that NASA is really trying to build connections with health. And they just launched the Tempo satellite, which you'll be hearing a lot about over the meeting in the next few days. They're also planning a satellite Maya, which I'll let Yang talk more about, which is the first NASA mission with the PI as a health researcher. So I think the part of, and actually I had I hate to be quoting him out of turn, but Pat Kinney years ago went to an AGU meeting. And he's like, I loved it. Everybody wanted to talk to me because he was the only health person at the AGU meeting. And so I think this idea of putting yourself in environments that are not your community, but where you're the other person, and then you get to be, like that, because it's very hard to collaborate with people who do the same thing you do. But if you put yourself in environments that you might not have thought to go to, that is a way that you're building those communities, even if they weren't already structured for that purpose.
That's a great point. And, what I like about that is that you acknowledge how it can be uncomfortable to be sort of that fish out of, I think you said black sheep, but yeah, I mean, you have to go outside your comfort zone. A lot of times you got to find people that see value in what you do. And I think the way to do that, differs by individual, but you have to have a shared goal that is discipline independent or approach independent. So it's like, we want to tackle the urban heat island crisis in Boston. I don't know, whatever. Like, that's how Lucy Hutira and I started working. It's like, I was like, lots of people are dying in Boston because of the heat. What can we do about it? And she was like, wow, yeah, lots of people are dying in Boston because of the heat. What can we do about it? And she has her discipline and I have mine. And I think we're more successful together than we would sort of independently in that particular project. So it's, but it is uncomfortable to sort of extend yourself out that at the beginning. It can be hard.
You want to talk about the Maya project?
Yeah. So, well, first of all, the funding agencies' mentality have been changing. When I was a PhD student, NASA was really, build it, they will come sort of mentality. So you're hands up, waiting for the right data to drop on your hand. But now they really, NASA in particular, really emphasizes societal benefits. What sort of products are the right products that can generate a lot of impact, right? Not only for science, but also for non-remote sensing users. Both Tempo and Maya they were born out of this new philosophy. So Tempo was the first ever air quality mission. Maya was the first ever public health mission. Their core mission is to improve our understanding of the air quality. Maya is to improve our understanding of the health impact of air quality. And then for these type of teams to be, this type of satellite missions to be successful, by nature, they have to reach out to beyond their comfort zone. I remember the first Maya science team meeting, there's half the room were epidemiologists, half the room are NASA engineers. We spent the first day talking about things we don't understand. We just couldn't understand each other. But then, by the third time, we kind of get a hang of it, right? So there's definitely this risk, this awkwardness built into it. Again, it speaks to the nature of this early stage interdisciplinary field. It's okay to be uncomfortable. It's okay to feel like I only understand 20% of what everybody else is saying. That's fine. If you work hard and eventually understand 80% of what other people are saying, you're the expert. You are that bridge, right? So take the long view. Think about it as your intellectual investment into a new venture, and then it's going to pay out. you have to stick to it for some time. And then for both mine and Temple, there are early adopter programs. You get to meet other like-minded people. Not all ideas will pan out, but take it, statistically. Like if you mean it, you try it, your probability of success will be statistically significantly higher than everybody else's chance.
Sure, I guess I can just come back to the sort of question about like what resources or databases are out there. And I think one of the reasons we keep coming back to like networks and community is that there are so many different platforms out there. And so depending on the question you're trying to address, the specific data set and the specific platform through which you access it might be different. NASA has a whole suite of visualization platforms and places to go and download the data. But in general, right, there's always kind of new retrievals, new versions, corrections. And so it just feels like being in touch with the experts, or at least knowing for your problem which of the platforms is going to be most current and give you the kind of metadata you need to understand that you are using the latest version, or if for some reason you don't want the latest version. Those, I don't know. So hopefully that makes some sense, but just that there's a lot of resources out there, but it still feels like there's a little bit of a need for human conversation to understand, at least for me, like which one is the one we want for this particular application.
Zach, are there particular resources, computational software, databases that you would recommend people look at, or examples of those types of databases that would be helpful, especially with a transdisciplinary sort of application in mind?
Yeah, I think the cafe we've already talked about a bit, but I think that one benefit is the goal of having a bit of community around that. There's a Slack channel that's associated with it, where it's intended that people would share resources that hopefully could point not internally to a cafe, to the collection on Harvard Dataverse, but identifying other resources that are out there. Computationally, I rely on BU's kind of internal shared computing cluster, which is great, but is something that's not going to be accessible to everyone. I know that there's some initiatives at NIH and through other institutions to try to expand access to the software needed to run some of that higher intensity computation, but I don't have any specifics in terms of where to point to that.
I was wondering if you can share some experiences or suggestions for choosing research topics to work on or establishing research agenda. So it's like apparently like we want to work on things that we're totally excited about. On the other hand, I feel like perhaps unique to our discipline, like I feel like sometimes I also want to balance that. On one hand, a lot of the research is motivated by fundamental research question, whether it's geosciences or health sciences. But on the other hand, because of the applied nature of our discipline, we also want to respond to like societal interest and some emerging events. Like one example in the air quality field is like now many more people are working on wildfire because it's happening in the real world and it's influencing people's lives. So I guess I was curious if you have, like in your career, you have had this for a point that you have an established research agenda, but sometimes you feel like you want to respond to something ongoing and emerging, and how you balance this.
That's a great question. Also a big dilemma for first-year assistant professors. Your time is your most valuable asset. You have to spend it very carefully. I don't know exactly which direction you should go into, but I think it helps to have a couple of trusted mentors, like your senior colleagues. Pick their brain, and then hopefully they give you a few objective pieces of advice, right? In the next 5 to 10 years, these are the biggest research topics in your discipline. And then I think in my own case, it's like, which one ticked in me? I feel like it's kind of a gut feeling thing. Among the 5 options I had, I just felt that I'm the most comfortable with 1 or 2 of them. Because you know the best about your skill set, your passion, and even personal experience. You know, I had asthma problems. I think about how to characterize pollen counts all the time. I thought about it for 2 decades until like 4 years ago, there's something came up on the market. Wow, maybe. Finally, I was able to characterize pollen. But coming to that, it's more like, yeah, I like numbers. I like to characterize things in the format of maps, 2-dimensional versus point measurements. I have a general sort of a inclination of sort of research habits, and then it will click. Sooner or later, it will, well, better sooner than later. It will click that I'm really good at it. I feel very comfortable doing this. A lot of people convince me that this is going to be a great topic. I'll spend some time trying it. But of course, as a first year, second year system professor, you have to think about fundability of your ideas. That's a second round of coffee or lunch with your mentor and asking them, are there good programs that actually fund this type of stuff? And then you have a kind of a prototype of your research portfolio that are fundable. You have the skill sets, collaborators, you kind of feel comfortable in this little space. Go for it.
I have a different answer.
Okay.
Because I want to say I love Yang's answer, but it took me so many years till I was like, I'm so good at this. And like, even now, that's only like 1 out of every few days, And so I think that there's this feeling of like, how do you navigate when you don't necessarily feel like you're super comfortable? And actually, oftentimes when you're hired, if you're hired as an assistant professor, the other professors may not know enough about your field to give you that kind of feedback. Like I had really helpful mentors at Wisconsin, but nobody who could have helped me decide how to build a research portfolio, except as like kind of reflecting what I was saying. And so I think, maybe just to have like a different model to approach, I think one, I totally agree, time, and that you need funding for the work that you're doing if you're hiring students or thinking about your success. And so, first of all, the more that you can be part of other people's proposals, that is a great way to increase your chance of getting funding without having to write it all yourself. So I think one way is to have a mix of the proposals that you're the PI on and a mix of the proposals that you're the co-I on. Another issue is that, sometimes you don't know what is fundable. And it's hard to say, I have this idea, I want funding for this, because then you're spending all your time trying to shop around like your 1 or 2 ideas. One thing that I found more successful and more relaxing is to almost feel like I'm a gardener of ideas and that I'm trying to plant a lot of little seeds of little ideas of things that I'm kind of interested in. And maybe they're things that come out of a conversation with somebody, or maybe like I saw that movie, The Martian, and I thought, there's satellites observing a dust storm on Mars. Like, maybe I'll study satellite data of dust on Mars, Now, that is a little plant that never really grew very far, But that's the example of how these ideas come. But to some degree, then spending a little bit of time on it. And maybe a different example that did cultivate is that one time I was the only atmospheric scientist at a meeting of ecologists, mostly people who studied birds. I think I told the story one time when we met. But, and I'm trying to make small talk with all these ecologists. So one of the things I said when I meet somebody who studied birds is I said, so how does air pollution affect birds? And their answer was, oh, air pollution doesn't affect birds. And I'm like, really? That's surprising. And so then I started asking other ecologists the same question, because this is a good small talk. And everybody had, well, what's the mechanism? And I'm like, well, I don't know about birds. I don't know how they would respond. So then I went home in my hotel room and started looking up on Web of Science. And I looked at like air pollution and birds. And indeed, there were only like 5 papers. And like there was a research group in Scandinavia who had a nest outside a copper smelter, but there just were not very many papers. And so that was a little seed that just sort of sat there and nothing happened until about 2 or 3 years later. And I had a student who came to me and she said, I want to do science communication to the Audubon Society that studies birds. And she said, so I'd like to write a review paper on, all the things we know about how air pollution affects birds. And I said, well, actually, we know very little of how air pollution affects birds, which I knew because I had spent like an hour on this topic. And so actually she wrote an NSF graduate fellowship program to the atmospheric science division, proposing to analyze birds like some other atmospheric constituent. And she got it. And then we did write a review paper and it was published. And so she did her master's with me, and then she did her PhD with a bird ecologist. And now Olivia Sanderford, she's a postdoc at UCLA, and she's probably the leading expert on bird impacts of air pollution. But again, so that was one that now grew, and now I'm not doing anything with birds anymore, but it was a productive idea. And so I think this idea, just thinking about like, you have your garden, and then that way when when an RFP comes out, you can kind of like go back to your garden and say, do I have any ideas that I've kind of been cultivating that might be a good fit for this RFP, which is an easier process than having one idea that you're really trying to get funding for.
That's such a good idea. And I love the analogy of the garden tending your plants. And I think that, my own career has been sort of pretty heterogeneous in terms of the things I work on, but what they all have in common is that I'm excited about all of the projects. And I think research is hard and full of setbacks, and that's okay. It's supposed to be hard because if we knew the answer, right? So sometimes that excitement is because I think the idea is just so important. And it's like, I'm going to figure out how to get it done, figure out how to get funding or sneak it on the side or whatever. And other times, the idea is just so fundable. It's like, how can I not go for it, right? And other times, it's working with people that I really want to work with. And, I wouldn't do this idea on my own, but I'll do it because I want to work with you or with you or with you. And any of those is fine because at the end of the day, we all have those days where like, we just don't want to get out of bed because the project's not working, because the staff has fallen apart, because the data set that was supposed to be clean and beautiful turns out to be a nightmare. And like, what's going to get you up out of bed on those days too? And it's not going to be usually paying the bills. Although that's an important part of it, it's not, the promise of funding. Usually it's because you care about the project in some other ways.
I was just going to try to pull together like the sort of different views that we just heard, just in the sense of, I think there were several people I think who raised their hands as being assistant professors in the room. And the reality is that at the end of 5 or 6 years, when you go up for tenure, you do need to be kind of the go-to person, or this is what you're known for. And so I think you can have a garden and also be focused. But the key thing is to have that umbrella that's like, here's my research program, here's the themes of how these pieces all tie together in some way. And it's of course not everything necessarily always has to tie together, but there has to be enough of a portfolio that that there's a community who can vouch for your expertise.
And I think there's also me too. I reflect on Tracey's point. There's also this difference between the soft money model and the hard money model, because NIH does allow you to resubmit the idea. And then the review is done not by ad hoc study, the review committees, but on a standing study section with a bunch of people serving on it for 5 years straight. So you have to think about that going back to early questions, that who's going to review your 10-year dossier? Who's going to review your proposal? Right? It, to a large degree, kind of shapes your strategy.
Any final online questions? No. Gage, do you still have a question?
I think Arlene actually just answered it.
Okay.
Serendipitously, yes.
Any other final questions before we close for the day? If not, I will thank the panel. This was fantastic. I learned many things that I'd never heard before. I'm sure everyone else here did too. And most of the folks here will be around throughout the meeting. So please seek them out if you heard something that you want to learn more about. And thank you very much for taking the time and for sharing